Okay, so how about a few questions, Dawn? Should we go ahead and do some questions?
Yes, yes.
Okay. So let me pull up a few. I'm going to pull one up for you, okay?
Okay.
All right, so this came in from Ruby, and she said, how early is too early to feed baby purees before completely going baby-led weaning? My baby just had his 4-month checkup, and his pediatrician told me to try giving him some fruits and veggies. Wouldn't it be too soon?
Oh, so, well, that's a huge question, and I'm super excited to answer that because, one, I love that you're already questioning that, and that already in your mommy gut, you're like, wait a minute, isn't 4 months a little too early? And here's the pros and cons of starting solids early as 4 months. The pros is if your pediatrician is telling you to start purees at 4 months of age, you are listening to your pediatrician, making sure that you have a great relationship with your pediatrician. The con is that the American Academy of Pediatrics and the World Health Organization and almost every single feeding therapist out there recommends not starting at 4 months, but waiting until 6 months. And there's a whole bunch of rationale to go through that and a whole bunch of different research, and more of that we will have on other videos that we've actually recorded. But to give you just a quick summary of that is, when baby is 4 months of age, you technically can start with purees. You cannot start baby-led weaning until after they're 6 months of age because of the fact that there's just a whole bunch more safety issues because you're having a big piece of food. Now, with that said, I don't like to introduce purees at 4 months of age either. Again, with those exceptions, if I have babies who are going to have a heart surgery or need to have some kind of surgery and need to gain weight and bulk up really fast, then of course we start to introduce solids at 4 months. But really, I don't prefer that because I like babies to actually be in a high chair in order to have really good positioning to decrease the risk of choking. And with the 4-month-old, they're just going to kind of face plant right into the high chair. And of course, as soon as they start to move forward, they're going to try to extend their head back, and that's going to open up their airway. And that's why a lot of the babies that I see that start at 4 months of age just really aren't ready, and they end up refusing foods. And so when it's 6 months and you're actually excited to start baby-led weaning, baby has no interest. And so sometimes starting early can really start a habit of food refusal because baby's just not developmentally ready to do that. So I would wait till 6 months of age. If you want to do something and get ready and prepared for that, then what I like doing is offering baby an open cup, which is empty, and a spoon. So you want to be able to offer an open cup that's empty and let baby be able to practice picking it up and playing with it, as well as offering a spoon that has no food on it and let baby pick it up and be able to explore it. And also start to work on having baby sit into the high chair for 5-minute intervals. So then you're really feeling like you're starting to prepare for the starting solids journey.
Mm-hmm. That's so good. It's such an important point. We've had so many conversations about starting solids and baby-led weaning and everything over the last couple of weeks with Dawn joining here. And it's just so obvious to me that we focus so much on like baby's gut being ready. You know what I mean? Like that's always what comes up is like, wait till the baby's got like 6 months and being really the parameter that for most knowledgeable people know, like should be waiting. But what I've also started to really understand in a much deeper way is that there's more readiness than just their gut. And
yes.
That's what you keep pointing out, which is being able to sit upright in a high chair, being able to hold their head up, you know, even their tongue thrust. There's so many reasons and things you want to wait for. And so it just goes to show you, again, it's one of those things where we come back to, there is no chronological specific age, like, okay, 6-month birthday, it's time. It's like we're telling you, like, this is the range, this is around the time, and you're going to look for the developmental stages of your baby. And sometimes they take a little longer, you know, and babies can also be a little delayed if they're premature. Like, there's just different reasons why babies can be a little later, and they're going to be getting the majority of their nutrition and their calories from your breast milk anyway at that point.
Right.
So
Right.
I think this is all just really important information that really, and it's, again, it's one of those things. It's why this goes hand in hand together with breastfeeding.
Yes. Yes, absolutely.
Mm-hmm.
And, and I think that's what I love about our advice is that we're coming from developmental and safety first. And, a lot of other experts don't talk about these developmental patterns. And so it's really important to be able to set up accurate expectations for parents, because it's so disappointing when they think, oh my gosh, my baby is not able to do this that other babies are doing. And I'm like, wait, but your baby's not supposed to do that for 5 more months. So don't worry. It ends up being this, like, I feel like parents are constantly feeling like they're failing, and the media sets them up for that because they're not giving them accurate information. And so they feel like they're failing, and then that just gets more and more discouraging. And when we actually come from a developmental standpoint, we're like, hey, baby's not supposed to do that for another 8 weeks. So you're good.
Exactly. And it's why knowing the normal is so important.
Yes.
Knowing what these milestones are. We've got somebody wanting to get into the chat here. Somebody let them in. When you hear that ding, okay, but I just turned the ding off because I literally jumped out of my seat. It'll tell me they're there, but it scared me. So I'm going to go ahead and let Jessie into the chat right now. And let's just see what she's got here for us.
Okay.
Okay, there she is. Hi, Jessie.
Hi, Jessie.
Can you hear us? I don't know if she can hear us.
I don't know if she can hear us.
There you go. Can you hear us?
Yeah, I can hear you.
Okay.
Hi.
Great. Hi, how are you?
I'm pretty good.
What's your question for us, Jessie?
I actually saw one of your videos that simply breastfeeding,
Yes.
and I was wondering what advice you would have for somebody that's struggled before to breastfeed, but is really determined to like exclusively breastfeed.
I love your question. And where did you see my class, Jessie?
I was actually in a pregnancy class, and they showed me the video.
Yep.
Yeah. I love the video because it like really like explains stuff down deep, and
It's so great. It's so great. Yeah. So a lot of you guys come to me from all these pregnancy resource centers across the country that have been using the Simply Breastfeeding program as their breastfeeding class for 8 or 9 years already. And it makes me so happy when you guys find me and you're able to, like, I know you're seeing them in your classes there, and then you come find me online so that you can actually continue on with your journey. And so your question is wonderful, and the timing couldn't be any better. The course that you saw was actually the 3rd edition, which was filmed quite a few years ago. I just finished filming the 4th edition of the course. And you can actually see chapter 1 on the homepage of my website already as a sneak preview. So I want you guys to all go look at it at mybabyexperts.com. And the full course is going to be ready in just a few weeks. We're just finishing the editing right now. And Dawn knows, I am beyond thrilled to get this all out to you. And it's exactly for questions like what you're asking right now. How old is your first baby, Jessie?
she will be 2 in September, actually.
Okay, and are you expecting right now?
Yes, ma'am, I am.
When are you due?
At the end of October, sorry.
Okay, good. So you still have some time. Good. And so you'll be able to watch the new course before the baby comes, which is great. So great. So I think that to answer your question, one of the most important things that you can do when you're having your second, if your first didn't go as planned, is to make sure that you understand that some of the things that could have gotten you derailed need to be addressed and understood. And so by re-educating yourself, and I think through this new version of the course too, you may look back and say, oh, I totally see where this happened or that happened, you know, and making sure that you look and say, okay, was this really me? Or was this something that happened to me? Or was this advice I was given that actually threw me off from where the real norms are and what I know as to be true. And so it's really important that you take a little bit of a stock or evaluation of what happened the first time so that you don't make the same mistakes again, right? That's number one. But then the other part of this too is to not feel discouraged because things didn't go right the first time. Every baby starts fresh. Every baby, you get a new opportunity to do this exactly how you want it and set your goals again. And so when you watch the program, and this is sometimes harder for second-time moms or third-time moms or moms who've had, this is their fourth baby and they were not successful with all of them before. And I've had so many students like this who tell me, I couldn't breastfeed any of my kids. And then I watched your program and I started following you and I started doing what you're telling me to do. And I'm exclusively breastfeeding. I really want you to start fresh because, as I say in the program, 2% of your success with this, and I'm looking down because she's down on the screen and I'm looking right at her. 2% of your success with breastfeeding is going to be those techniques and the normals that I teach you, okay? But 98% of your success of making this happen is going to be your confidence and your commitment to it. And if you come into this with your confidence already low because you're thinking of the last time, it can really undermine your success this time. So I need you to promise me that you're going to start fresh as if this is the first baby you ever had. And if there were issues from the past, you're going to look at what were they? Because if they really were true issues, we want to address them now. That could be things like a hormonal issue that maybe you had. If you had low milk supply, was it really low milk supply or was it a perceived low supply? These are the things that we need to look at right now and make sure that we address before the baby comes. I think watching the course is the first step, and I want you to have access to that, Jessie, and that's why I created it. All right, that's going to be your first step. So in about 2 or 3 weeks, I'll have the whole thing ready for you. Okay, so like sometime around mid-September, the whole thing will be ready. You'll go watch the whole thing, and then you can join us into the Q&As. You can follow up with questions if you have them, but really just trust your body this time and really go forward as if this was the first time.
Mm-hmm.
What was it last time? Can you think back and think of like what really went on last time?
Well, when I was in the hospital, and usually they have the lactation consultants that are supposed to come in and, you know, help you with getting latched, and I couldn't get her to latch right at all.
Mm-hmm. Yeah.
And the lactation consultant, she was like really nowhere around. So
yeah, it's the lack of support, you know. And so one of the biggest things, I think, if I had to tell you a big difference that's in this program from the last one from 10 years ago, a lot of research has been done on skin to skin and the importance of skin to skin contact with your baby immediately after birth, like right away, and at least for the first hour and more after the birth. Okay, staying in constant skin-to-skin contact and continuing to go back to skin in those early days and weeks, because it's more than just helping the baby to regulate their body temperature and their heart rate and their breathing and all the things that we know skin-to-skin does. It literally sets the baby up for a better latch. And so, you know, having skin to skin and not wrapping your baby in a swaddle or like in blankets and then unwrapping them when it's time to eat. When you do that, it makes the baby have a more difficult time latching. And typically what happens is the baby's all wrapped up till the clock says it's time to eat. We unwrap the baby and try to get them to latch, and then they can't. All right. So if you're struggling with latch this time, and you'll see, I'm going to repeat this over and over again through the new program because it's probably the biggest thing that really needs to be said. That if you're struggling to latch, skin to skin, it'll be like my answer to everything, skin to skin, because it really is the answer.
And just chiming in here really quick, Jessie, too, just because everything that Shari and I say, it really is this collaborative thing. It's the same thing with 6-month-old babies and toddlers, you know, where they're clothed and then they get ready to be put into the high chair to start solids, and they take off all the baby's clothes, and then baby is cold and trying to explore these wet foods, and baby refuses to eat. it's kind of the same thing. If you're going to take off baby's clothes, you want to bring them to skin before you actually set them into the high chair so that they can calm down, help with their sensory system, be able to want them to be able to participate in this feeding and bonding experience. So it's just so funny. I had to like chime in on that because we have not heard each other say that before, but it's even more important too as a baby gets older as well to be able to have that skin to skin before you place them in the high chair to start solids.
Congratulations, and I'm glad you found your way to me here.
Yes. Nice to meet you, Jessie.
Good luck.
Nice to meet you too.
All right. Take care, sweetheart.
Take care.
Bye.
Bye.
Aw.
That was fun.
So fun, right? It's so
Oh my gosh, Shari.
I love when my students find me. And what I mean by that is I know that they're watching it all over the country in these pregnancy centers. And when they can find their way to me, then that ongoing support takes place right here. And it just like nothing makes me happier. So, and then to know that they're going to get this brand new course and everybody, you're all getting it for free because commitment to you, because I love you all so much. And I want to support you with your babies. Like that's really what this is all about. So I'm working very, very, very hard every day to get this thing finished and edited so it's ready for you guys. All right. So
Yes.
wonderful. All right. So let's do this. Let's go back to the questions here. I'm going to answer another question. And you know what? I'm going to try to pull it. First of all, I just want to pull it for those of you guys who are trying to win the prize today, which is from Love to Dream. And as we said, you just have to type #MyBabyExperts here in the chat. And that way you can get the message from me, and also just comment here telling me what you love about Love to Dream. If you're like, I have no idea what you're talking about and you don't know what Love to Dream is, I just want to show you what this is. Okay. Love to Dream is a brand that makes swaddle suits for babies, and they do it with this very unique way that has the arms. It's called a swaddle up. And what that means is that the baby's arms are still in, which helps to suppress that Moro reflex, helps babies to sleep better and soothe themselves. It gives them that nice tummy, tightness on their tummy that they need, but it keeps their arms in a more natural position, which is up. And if you look at a baby and how they sleep, I challenge you, find a baby who's not swaddled and lay them down. Do you think their arms would be down at their sides?
Right.
Are your arms all down at your sides, when you're sleeping? No, we tend to put our arms up when we sleep, and so do babies. And so this is a more natural position where they can still be in that up position, that hands up position, and yet it will hold them tightly the way that they want to be held. All right. So this is, and they can also, the thing I love about this too is we were just talking about skin to skin, and I want to mention this, we are doing, when we talk about skin to skin, this is a very good swaddle for breastfeeding as well. Two reasons that I really like about it. One is that, one of the early feeding cues, and I go through this a lot in the new program, is to be able to see when baby's putting hand to mouth, okay? That's one of their early feeding cues that you want to pay attention to. When they're swaddled with their arms down, you can't see those cues. And so you can miss the early cues, which then has them get hungrier and hungrier. You're delaying the feeding. They're starting to cry, which is a late sign. You don't want to wait for that. It can all have all kinds of ramifications of decreasing your milk supply and poor weight gain and all kinds of other things. So we want baby to be able to bring their hands to mouth. The other part too is that when we're talking about skin to skin and not overheating baby, this is a one zip. It's a single layer, and you can unzip the entire thing from the top here. One of the things that I like to tell parents is dress the baby appropriately underneath, but you can also dress them in just a diaper. And so that if you were to put this onto them, it's a one zip skin to skin access, so that when you go to actually go breastfeed your baby, you literally unzip them, and now their body is up against yours, which is what you need them to be, skin to skin. Okay, so you don't have to go wrapping a million times with a blanket. So that's what I love about Love to Dream. And I know that so many of you guys already have these. Yes, Stephanie's here. Hi, Steph.
And I love it too because of that exact rationale of being able to have babies to have accessibility to their hands. Again, when we swaddle babies and the hands are down, then it makes it even more difficult for when we end up starting solids. We need baby to have access to moving their arms and moving their hands, so they're actually working on that hand-to-eye coordination very early on, so that they're giving you those signs that Shari was talking about for breastfeeding, but they're also mastering those skills in order to go to solids. So if you sit your baby into the high chair and they're 6 months of age and they're actually not reaching across midline and being able to explore, those are usually the babies who've been swaddled all day. So it makes it really difficult for babies to be able to work on those fine and gross motor skills when they've had no accessibility to it. So it actually prevents that development, which makes them delayed when starting solid. So all of these feeding cues that you go through breastfeeding, and you're going to learn this more and more as Shari and I are doing this together, those same cues are the exact same cues for starting solids. One of the number one cues that babies ready to start solids is that they're actually bringing their hand to their mouth when they're watching you eat as well. Mm-hmm. So in order to have that accessibility and in order to have that practice and repetition, we can't bundle up baby to where baby doesn't have that ability to be able to work on those skills.
Absolutely. Absolutely. And that's the other part too, with the 50-50, that's the stage 2. They can actually zip their arms completely out. This comes off. Great transition. So there's a lot of real thought that went into this, and it really works with your baby's, with the natural needs of your developmental needs of your baby, which is what I really, really love. And we have Gloria waiting in the waiting room. So everybody's in today. So let's go ahead and bring Gloria.
Let's do it. Breathe women today.
I just had to read this. So I'm just, because it makes me so happy to see this, but let's see, where is it? Shiva said, I think hospitals should have Shari's videos in the room along with other videos they play for us.
Yes.
Yeah.
Yes. Help make it happen.
I'll say yes to that. Oh my goodness. Okay, let's bring Gloria in.
Okay.
All right, here she is. Hi, Gloria.
Hi, Gloria.
Hold on, I think I have to unmute her. Hold on. Can I unmute her? Where is it? Unmute? I thought she was.
Yeah, it looks unmuted on my end.
Okay, Gloria, can you hear us? Gloria? I don't think she can.
Oh, now she's muted.
Okay, hold on. Unmute. There you are. Can you hear us now?
Yes, I can hear you.
Hi.
Awesome. Hi. Oh, I love your screen behind you. It's so cute.
Thank you. Setting up for my daughter's first birthday party. So
it's adorable. It's adorable. I love it. How are you?
Good. How are you?
We're very good. What's your question for us?
Okay, so my daughter's obviously going to be 1 here in a week. I've been exclusively breastfeeding on demand. Now my nurse, I have a nurse that comes out here every once in a while. My daughter has been struggling eating as much solids as she should, like transitioning. And my nurse suggested that maybe I am, like, she's snacking too much throughout the day, like on my breast milk. So my question is, how long should I go in between breastfeeding so, like, she's hungry enough to want to have the solid foods and make that more of her diet? Because I know, like, after 4 hours, I'm, like, really full and hurting. So yeah, that's my question. Just how do I transition? Like, how much should I be instead of, her constantly? Because she did notice, like, I logged out her eating and everything because she was losing weight here and there. And they said it just looks like, I'm trying to offer good foods, but I'm breastfeeding an awful lot.
Mm-hmm. Are you offering 3 meals a day? Are you at that 3 meal a day transition?
Yes, and she's usually only wanting to eat a little bit. Like, I can only get her to really eat once a day of solids, and it's only like 2 ounces at a time, and it has to be something sweet. Otherwise, she wants nothing to deal with it.
Mm-hmm. Okay.
Can I just say one thing about the weight loss? You know, one of the concerns I have is that you're trying so hard, and I'm sure Dawn's going to address this, that you're actually delaying the feedings. And that right in itself could have her be losing weight, you know, so she's actually wanting to nurse. So I'm going to let Dawn take it from there. But I do think that even at a year old, the breast milk is still super important for the fat and calories and everything that's in it. So I'm not completely in agreement with you, like making her starve to the point where using starvation to cause her to eat more solids. I don't think it's not going to work. And actually what it's doing is it's going to impact your milk supply and it's going to have her lose weight. So that's what I'm going to say about it. And then I hand it over to Dawn because I think we're probably on the same page.
And I agree too, because Gloria, what's happening is that you have a feeding relationship and this bond with your daughter that you have made over breastfeeding. And if that bond breaks, and as you're starting solids, because she wants to be able to have that connection with you, then what happens is that she will continue to refuse to eat solids. So what you might want to do and is, you know, breastfeed for a few minutes, have that skin to skin that we were just talking about, and then put her into the high chair as you start solids. And you still want to be able to be close and connected to her. So you want to, when you put her in the high chair, be right at her eye level, not standing over her. You want to be at her eye level, so that could be bringing up a small stool or a little box or something so that you can still have that eye contact as you're introducing solids and taking the same amount of time that you would to connect when you're breastfeeding during solid introduction. You also can put a half an ounce to an ounce of your breast milk into an open cup, because at 12 months of age, developmentally, baby's supposed to be drinking from an open cup. So we want to make sure that she's able to drink from an open cup with a little bit of spillage. So the way that you can also provide her with that great nutrition, but also check off these feeding developmental milestones that need to happen for independence, is you can still breastfeed and then put it, breastfeed beforehand and then put some of your breast milk into the cup so that she has that at mealtime as well. I find that a lot of babies who really want to breastfeed and want to have that nutrition do really well when we put that into an open cup, and it ends up being more of this mealtime, and they're still getting the taste of your breast milk and getting the eye contact and that connection with you, even though you're not breastfeeding. So sometimes some of our kids just really need to continue with that connection and be able to have your one-on-one attention during that. And I know that's challenging when you're trying to breastfeed a couple times during the day and offer 3 meals a day. But if you just do it for, you know, a couple of meals at a time, you'll see that she will start to slowly be more interested in that. And again, you can also add some of your breast milk to some of the foods. So if you want to, you know, cut up, you know, slices of avocado, you can drip some of the breast milk on top of that as well and let that soak in. And there's lots of different foods that you can actually do that with. So she has that same taste and feel that is very familiar to her. And her sense of smell is completely enhanced when we actually add breast milk onto our solid foods as well.
That's a great idea.
Thank you.
But you still suggest to, like you said, try, instead of offering solids first, try to breastfeed for a few minutes first and then do that. Okay.
Yeah, and the reason why that's critical as far as for me, and then I'll let Shari add to that too, is because we want her to be able to have that connection. She's used to being able to do that. So again, we're not doing it for 20 minutes, but we're giving her a chance to be able to have that connection. And then when you put her down into the high chair, you're immediately sitting down as well.
Okay.
So maybe you're breastfeeding and kind of walking around, getting some solid food ready, putting that onto a plate, putting that onto her high chair. You're taking her off the breast, putting her into the high chair, and you're sitting down and connecting with her. So that connection isn't changed. And then Shari, do you want to add to that as well?
Yeah, I mean, I think we addressed the idea that, you know, the breast milk is still super important for nutritionally, and for her to be getting enough of her calories. She could still be getting most of her calories from the breast milk, which is what you want, really. But there's, to just go back to what Dawn's saying here, she still wants you. There's more to the milk than the milk itself. You know, there's more to breastfeeding than milk. And so this whole idea of like holding her off, she's only 12 months old. You know what I mean? She's really just still like just a baby. And so the fact that she wants to nurse, they come to the breast for so many reasons, and I wouldn't keep delaying her.
Okay, thank you.
This is putting a lot of, I could feel it just listening to you and talking to you, that you feel a lot of pressure. You know, you're feeling a lot of pressure, like you said, the nurse is coming to visit, they're giving you advice, this is what you're supposed to be doing, all the should have, supposed to's, like ways that you're not doing it right. And the truth is that if you just follow what feels right, which is she wants to nurse, let her nurse.
Right.
And then
Yes, and I don't want to dry up because I plan to nurse, for a couple of years. So that's why I was worried about when she told me to like basically make sure she goes hungry, because I'm not letting her be hungry. And
can I ask you, Gina, Gloria, Gina was our last person. Gloria, how did it feel when she said that to you? Did that feel right to you?
no.
Mommy guts. You got to listen to your mommy gut.
I'm asking that question because we're going to keep asking everybody those questions, because the questions you usually have the answer. And I know, you know why I know that you already have the answer? Because you wouldn't jump on and ask the question.
Yes.
Yeah. Like the fact that you're confused, the fact that the nurse or your pediatrician or some expert that's talking to you told you something that left you confused means that it didn't really feel right. That's the confusion you have. You're not confused by what she said. You're confused by your own feelings of like what you think you should be doing and what they're telling you should be doing. And I really want you to keep trusting your own gut. It's so important. It's so important. It'll make you follow what you feel is right. Two, it'll have you seek the right information, right? So by trusting your gut, you might not know the answer. You just know this doesn't feel right. And then you jump into the live stream and ask people who you trust the real answer to these questions.
Yes. Yes.
Yeah, thank you so much. I appreciate that.
You're very welcome.
Welcome.
Happy birthday to her.
Yes. Happy birthday, baby.
To both of you. Happy birthday to both of you. Bye.
Bye.
Okay. It's so true, right? It's so true that they already know the answers. It's the reason why she's saying, oh my God, this is what they told me. I don't know what to do. It's that feeling of confusion because you're being conflicted by your own internal voice and the voice of whoever has those letters after their name.
Yes.
Mm-hmm. Right. But that's why we're here to help you with that. Okay.
That's right.
I'm here to help you. And I do want to say that just because somebody has letters after their name does not make them an expert in a particular area of expertise. Okay?
Yes.
When it comes to breastfeeding, if they don't have the credentials IBCLC after their name, they're not the top expert in that. I don't care. Unless they have those credentials, that's the expertise for that. If they don't have Dawn's letters here as a feeding specialist and SLP, and I mean, they're not the experts in feeding.
Mm-hmm. Mm-hmm.
Correct?
And then it's well-meaning, it's just not accurate. And I think that could
always well-meaning. It's always well-meaning. I want to say, I agree with that. It's always well-meaning. Okay, so let's go back to our questions here.
Okay.
And answer a few more questions for everybody. I'm going to answer a breastfeeding question. This question came in from, let's see, where is it? I had one here. Oh, okay. Tiffany. Tiffany said, I exclusively pump every 2 hours and I had a freezer stash. I pump around 3 ounces every 2 hours and my little one drinks about 5 to 6 ounces and my stash has gotten down to about 7 bags. I have 1 bag in the fridge. I don't know what to do. I've been feeding him 5 to 6 ounces of baby food twice a day and that helps, but he drinks he drinks most during the night. Any advice on how to boost my supply? So here's what I'm going to say about that. This is one of those situations where we talk about do you have a low milk supply? Like what's going on? Why did your milk dry up? Why are you not making enough? Why would that wouldn't even make sense that, your baby body would not keep up with your baby. What's happening here? Or is it a perceived supply issue because we're expecting something that is really beyond expectation, right? So if we think about on average, how much the body typically makes per hour when we talk about breast milk, we're talking about 1 to 1.25 ounces per hour. So if you're pumping every 2 hours and you're getting 3 ounces of milk, calculate that. That's about 1.5 ounces per hour. Perfect.
Yep.
Right? So it's like actually your body's doing exactly what it's supposed to be doing. So then the question comes up, well, how come the baby's eating 6 to 7 ounces or 5 to 6 ounces every 2 hours if my body is only supposed to make 3? And the answer is most likely if your baby was eating at your breast, they wouldn't be eating that amount. Okay. Most breastfed babies will hit somewhere around between 3 and 4 ounces per feeding. If you're going like, 3 hours between. And it doesn't really get more than that the whole year if you were to continue at the breast. They may eat a little more frequently. They may eat a little bit more in the morning when your breasts are fuller. They may eat a little less in the evening when your breasts are less full, but the fat content is a little higher. There's all these other variables that go into the baby at the breast. Then you go and you take that breast milk and you pump it into a bottle and you start to try to modify what we would normally do at the breast, and you see that all of a sudden the baby drinks twice as much. What's happening? What's happening is that often babies are overfed with the bottles. People are not feeding them and pace feeding them where they're allowing the baby to regulate the speed at which they're drinking. The flow of the nipples are too fast. The baby is tilted, laying down with the bottle put into their mouth, and what do they have? No choice, or they have to swallow or they're going to choke, right? They can't stop the flow the same way they do at the breast. Babies can breastfeed at the breast to eat. They can also breastfeed at the breast to just suck, and no milk is coming out at that point. They know how to control the flow, which they're usually and often unable to do with the bottle. So my advice is that you take a look at how that baby is being fed. Maybe on a day off, if you're back to work and this is when it's happening, why don't you try feeding your baby with a bottle and do it while you're pace feeding? And there's different videos. We have some on our new library coming out about pace feeding, but it's essentially you're sitting the baby up, you're holding the bottle in a direction that doesn't lay them straight down. You're feeding them and then you're waiting to see as they slow down. You're taking the bottle out of their mouth. You're giving them those pauses that they would normally do at the breast and allow them to control the amount and the speed of what you're doing it. And you would stop frequently to see if the baby's done and if it's really just more sucking that they're trying to do. Do they want to be just held more, and test that so that when you go back to your caregiver, you can give instructions. It's really up to you. As the mom, it is going to be up to you to teach your care provider how to feed your child your breast milk. And I can't give you advice on how to start making 5 to 6 ounces in 3 hours.
Right.
I can't. People do this. They start drinking a ton of water, which will actually have the opposite effect and lower your supply. They start taking all kinds of supplements or eating cookies thinking that's what's going to do it. That's not going to do it. Okay, that's not going to do it. And yes, can you have low milk supply issues? And can some of these, herbs and other remedies help if you need it? But if you're trying to create an oversupply, that would not be my advice.
And if I could just add to that too, Shari, did she say how old the baby was?
She did not.
Okay. In my experience too with bottle feeding, what tends to happen from a communication standpoint is when baby is drinking and sucking, we end up having more eye contact and we're talking to baby more. And when they're sucking, then we are not communicating and talking with baby. So sometimes
you just said he's 7 months. Sorry.
Okay, great. Okay. So sometimes baby will continue to suck and drink just for that communication and interaction. And so I find from that language standpoint, baby will be willing to drink and overfeed in order to be able to get that language stimuli. And whereas we tend to talk more and we have the heartbeat and we're rocking, we're doing all these different things when we're actually breastfeeding. And then we stop doing that when we're bottle feeding and baby is craving more of that language input. Also, if baby is being fed bottle and lying down, what happens too is that sometimes we could get little ear infections from being at a different positioning. And so the best thing that feels good to babies when they are positioned laying down for bottle feeding is to actually drink, to be able to help with that discomfort and pain from the eustachian tubes. And so again, it may be that, you know, we need to change that positioning for bottle feeding and actually increase that language communication, and then baby might not be drinking as much just because they might be doing that to be able to kind of offset this. And then at 7 months of age, we're offering from a solid standpoint, like 1 or 2 meals a day. So just to be able to have that be more complementary. And, you know, that first month of starting solids, you know, we're just kind of getting used to it. And, you know, the next month, which is the 7th month of starting solids, we're actually starting to gain a couple of teaspoons to tablespoons as complementary to your breast milk. Also, introducing an open cup will also help. So being able to take some of your breast milk and put it into an open cup, it'll decrease the use and need from a bottle and actually help to be able to satiate baby more, because they're actually working on these skills and being able to really impact from being sitting up into a high chair and drinking from an open cup, which is a developmental milestone, will help with that as well. Because as soon as baby's 12 months of age, I want baby to be weaned off of the bottle. So it's really important to be able to start with open cups early and often, so that when baby hits 12 months, we're off the bottle and not having to worry about oral motor issues and feeding concerns then.
That's a whole other topic we need to be talking about. I think we'll do something on bottle feeding, pace.
Yeah.
We'll come back and do something about that. I saw that Lindsay, the original person who jumped in to join our live stream, jumped in and then jumped out again. So Lindsay, I know you were waiting there, but if you want to come back, we will take your question if you want to come back. Anybody who joined us late and wants to get in on the Love to Dream prize, it's not too late. Okay, so I would like for you to just type the word #mybabyexperts here, and that way you'll get the message. And you'll also need to type something here, some kind of a comment here in the stream telling me what you love about Love to Dream, why you need it, what features excite you most about it, anything you want to say, any nice thing you want to say to all the people over at Love to Dream who created such a great product for everybody. Oh, Lindsay's back. Let's answer her question.
Yay.
All right, there she is. Hi, Lindsay. Hold on, I think I need to unmute you. Here we go. I'm getting better at this. There you are. Hi.
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 So I was having trouble getting in, but anyways.
Okay, here. I know, I saw you in and out there, so I'm glad you made it.
My question is, with my first son that I had, he had a really severe tongue tie and lip tie. And I had a lot of trouble at first nursing. I had to use a shield. He got it revised at like 3 weeks, and his lip ended up reattaching. I was still able to breastfeed successfully, exclusively, but I don't know if that's something to be concerned about now that he is a toddler, and now that I'm expecting another child. Does that child have the same likelihood of having the tongue tie and lip tie with the same, you know, dad?
Yeah.
Did you say that the baby you had the tongue, the lip revised, and also the tongue?
Yeah, his tongue was almost 100%, like it was almost heart-shaped.
Gotcha. Yep.
So I was wondering why I was struggling so much at first, and then come to find out that was the biggest reason why.
Yeah. Dawn, do you want to take this, or do you want me to?
Yeah. We do a combo. So yes, we do find that when it's in the family, it's in the family. So you know, and now that you know that you had some difficulties there, that'll be the first thing that you check. For you to check yourself, and then also whoever is in the room and on your team to check as well, just so that we can have a double check when you're getting ready to assess baby. And as far as your older one, has that reattached now?
His lip did, his tongue did not.
Okay, and is there any functional issues, any speech issues, any feeding or picky eating?
He's definitely a picky eater. Like, you can tell he has a space between his front teeth because it's attached. But he I don't know if he's not speaking yet just because he's a little behind than most kids, or if that's something that could be a huge issue.
Right. So we always, you know, there's plenty of kids out there that have a lip tie or a tongue tie or a cheek tie and that do well from a functional standpoint. It's when that we do see some delays. So if what you're saying is like there are some delays in speech, there are some picky eating concerns, we definitely want to have that reassessed and re-looked at because sometimes it's just a matter of mobility issues. And if you don't have the mobility to be able to use that muscle, then you tend to not use the muscle. So especially when baby comes, we always see that sibling from a speech and language standpoint take a regression and start doing baby talk and wanting to get more, you know, attention. And so if you can put that into your very demanding schedule, I'm sure, is to have that reassessed so that we can you know, check off toddler first before baby comes into picture, and then you're going to kind of lose that time that to be able to give them that one-on-one to help with that language and speech delay.
Okay, would that also affect his ability to use a cup? Because I've tried like those spelt cups, I've tried a bunch of different ones with him and he still struggles. Like I was never able to give him a bottle, he wouldn't take it, never took a pacifier, so getting him to take a sippy cup was like a huge thing.
So a sippy cup keeps the tongue in a very immature swallow pattern, and it can make it very difficult for kids who have a tongue tie. You want to try drinking from an open cup, so we're just using really strong lip closure instead of actually incorporating the tongue. Start using an open cup to be able to help with that. So no lid, no spout, no nothing, just open to be able to assist. And then if you can have the cup be flexible as well, that's going to make it even more easy for him to really work on that good lip closure and have the tongue elevate to the roof of his mouth and practice that instead of going in and out, which can exacerbate that issue as well. And Shari, do you have stuff to add to that?
Yeah, I was just going to say that for sure, this, you know, first of all, congrats that with the issues that you've had, that you were able to exclusively breastfeed.
Yes.
That was a huge thing. As you could see, he wasn't taking a bottle. Like all these things are typical and very often the case with tongue ties and lip ties. People think, oh, it's just as simple as switching to a bottle, but they're going to struggle to suck on a bottle. They're going to struggle to drink from a cup. They're going to struggle with other things. So I'm glad that you were able to successfully nurse, but I'm going to assume that there probably were some struggles with it. It could have come with supply issues. It could come with pain. It could come with like, you know, lots of gas where they're like swallowing a lot of air and releasing and all these, you know, not holding the seal the right way. And so I know because I breastfed a baby with a tongue and lip tie and didn't at the time know that that was what was happening. But looking back now, I can see that. And I know how difficult it can be. I also have somebody who works with me who literally is having her child's tie revised right now at 5 years old because of issues and looking back at breastfeeding issues and the same thing. When it comes to the new baby, for sure, this is a genetic thing. That doesn't mean that the baby will definitely have the same level of ties that the first one did, but it is definitely something you want to address. And if you're having any kind tongue tie and lip tie is sometimes can be assessed just from looking at it when it's as bad as you're talking about. But most of the time, the way that we look at revising them is more about function and what's happening. You know, so if any of these things that I just mentioned are going on, you want to be in there immediately. And when I say in there, where does in there mean? I'm going to tell you that most people just go flying into their pediatric dentist or their, you know, ENT, like whoever's going to do their revision. It's really not the first place to start. The very first place you need to start is with a qualified IBCLC who knows exactly what they're doing, because the revision is one part of it. You know, that child, the tongue is attached to every other muscle and ligament and everything, into the neck, into the way they're nursing, and they need to, whatever's happening, even after the tie is completed, they still need to have the suck training and they need to be assessed to make sure that they're sucking right at the breast, or you're going to have all the same issues with painful latch and low milk supply and all the other things. So find yourself, what I would do right now is find yourself a really great IBCLC in your area who has experience with this.
Okay, well, thank you guys so much.
And then get assessed right away, like right away. Whether you're feeling like there's a problem or not, just get assessed right away.
Awesome. Well,
Absolutely.
thank you guys.
All right.
Yeah, thank
Good
you.
luck.
Thank you,
Congrats.
Lindsay.
Congrats on, when are you due?
November 5th.
November 5th.
Yay.
Okay.
A
Awesome.
fall baby. Congratulations.
Thank you.
Bye.
Bye.
All right. Awesome. Oh, it's so nice to have everybody jumping in today. Isn't that wonderful?
This is great. And
It takes a little bit of time for everybody to get used to the routine
Yes.
around here.
I just want to say, I can't begin to tell you and your community how many times I get assessments for kiddos that are going into school for the first time, and they've never had an oral assessment, and they are speech delayed and language delayed and have picky eating, and parents are frightened that they're finally going to school and what are they going to eat. And they come to me, and I go in to do an oral assessment, and there's a tongue tie or a lip tie, and we start talking about all these struggles, and they just didn't know where to go. And so they knew there was something wrong, but they didn't know exactly what it is. And I would say maybe 30 to 40% of my picky eating assessments are actually toddlers that have a tongue, lip, or a cheek tie that just has never been diagnosed. And sometimes these kids have been in speech therapy for years, and the speech pathologist didn't go in to do an oral assessment. And that's the most important thing that we can do as clinicians, is to actually get in there, look into the mouth, check and assess for that. And sometimes I'm just like, I'm out. You don't need me right now. This is causing so much tension that it's really hard for them to get the tongue up to be able to do an L or R, or to be able to increase their vocabulary, because you don't want to speak in 5-6 word phrases because it's uncomfortable. And for some of these kids, it actually hurts to talk and eat. And so I just wanted to say that as a side comment, because it's great that Lindsay's looking into that, before she even gives birth, that she's already preparing, and she's looking at, hey, my young toddler is still struggling too, and to get that fixed before we go into school and having, even more issues. So
Totally.
Proud of her.
Yep, absolutely. Absolutely. Love the preparedness of our community, right?
Yes.
I'm looking here. Lauren is asking, where do you sell your products? Meaning the Love to Dream, I'm assuming. You can go to lovetodream.com. You can buy the products right there. There's a link if you do the hashtag MyBabyExperts, you get a message from me. There's links through there, so it'll take you right to Love to Dream. They're also sold at Target as well as other retailers, so you can find them online. But if you really want to see everything about them, I would just recommend going over to lovetodream.com and checking them out. Check them out, because they have a 3-stage, and it really goes right through toddler. You're going to love it. You're going to love all the different stages. Stage 1, 2, and 3 are so cute. So make sure that you go check them out there. Yes, and so we're going to be pulling winners, and while Stephanie's pulling winners and double checking all of your entries, you make sure you did hashtag MyBabyExperts and that you all commented here. We're going to be pulling a winner. We're actually going to have 2 winners today, Stephanie, so you can go ahead and pull 2 mamas today.
Woohoo!
They'll get their choice of whatever stage they want. I also want to tell you about another giveaway that is just started on our page as well. It is something new that Dawn and I are going to start doing, and this is called the Learning Journey, okay? And we just love it because, as you can see, the products and the brands that we're talking about there's always a reason for us. They're either products that help with your baby's health or safety or comfort or development. There's always going to be a reason why we're talking about certain things, and these products become the tools to the education that we're providing you. So if you think about the things that we're talking about today, there's tools, there's cups, there's swaddles, there's pumps, there's things that we're talking about go hands in hand with the information we're giving you. And the Learning Journey is just the perfect thing that we could think of to help you in an individual way to get more information about the things that you need to know. And we're going to start off today with a really awesome brand called Bundle of Dreams. Just recently became partners with them, and they make these amazing 100% organic crib mattresses that you have to see. I don't even know how to express to you. I have seen this in person. It is unlike any of the other mattresses I have seen, and I'm not kidding you. Just so soft, so nice, 100% organic, completely breathable, no plastic, no nothing. Okay, there's no off-gassing, all kinds of things. But I'm not going to say any more because the Learning Journey is going to take.
It's going to tell you.
what that means is when you sign up for it, and if you go to my Facebook page, you'll see the post from this morning. It's actually just about an hour ago. You just have to type the word learn over there, not here, over there, okay? And it will get you into that sequence. You'll be getting a message from us every single day for the next 5 days, teaching you something else that you need to know that will make parenting just a little bit easier and your choices a little bit more knowledgeable, okay? And so, and then there's also a nice discount code if you decide at the end that you'd like to purchase one, but we're gonna be giving away one of the Bundle of Dreams mattresses at the end of the week, okay? So make sure you go enter. Did everybody enter that? If you didn't, go do it, all right? And we'll be talking more about it. You'll see, you're gonna get messages from me. You just gotta answer.
It's gonna be fun. It's gonna be fun.
You know what? We just feel like we wanna reward curious minds, okay? That is my motto, is I wanna reward those curious moms and dads who love to learn and get more knowledge. And so we're going to reward you. And this is going to be just the beginning. Okay. So we're starting that this week, called the Learning Journey. All right. So yay. I'm glad that you all are doing it. And we are done for today. Dawn, thank you once again for an awesome Q&A.
Thank you to you know, everyone that came on. That was a new one for me. I have never been on one. I've seen it,
really?
but I've never been on one when people actually came on. So thank you.
The best. For coming on. The best thing ever.
Yeah, it was super fun.
It's super fun. We want you all. And by the way, we're doing this on Zoom now, so we literally can have a party. So if we wanted to have a few moms on, we could start doing some fun things. We'll test my technical skills. Okay.
Yeah.
Go ahead, test me on it. All right, guys, have a wonderful rest of your day. Happy Wednesday, and go join the Learning Journey. And thank you to Love to Dream, as always. Mwah. We love you so much, and we'll see you all later. Bye.
Bye.